This session will review the first act of the practice production, the first impression. Just as the name implies, this is the initial experiences that patients have with the practice that create their impression of the organization. The first impression is not just created in the office or on the phone. The first impression begins with the first time a patient hears about the practice, visits the website, or sees an ad for the practice, and continues until the medical provider enters the room for a consultation. Within the first impression of the practice production, there are several key interactions that create lasting impacts on patients. In this session of the practice production, we will walk through the process a patient typically takes in order to get a consultation and the factors that help that patient make a decision to get treatment before the provider even walks in the room. I will review each key interaction, discuss the factors of consideration, and give you real examples that you will be able to use within your practice to create your practice production. Creating a remarkable patient experience isn't just about making the office a better place for your patients. A remarkable patient experience will result in improvements in every sales metric that can be measured, generating more revenue, increasing patient referrals, leading to decreased marketing expenses, more patients, and more profits. Before we get into the details of the first impression, let's talk about the people that pay the bills: patients. Unlike traditional medicine, elective medicine caters to people that are a consumer first and a patient second. A patient seeking a medical treatment is a captive individual that has little to no choice in the care that they are provided, thanks to costly insurance plans with increasingly greater restrictions on physician networks and coverage. Unlike a traditional patient, an aesthetic patient is a consumer and needs to be assured that they are making a good decision about where they should spend their hard-earned money. The patient experience is the foundation that provides a basis of trust and confidence that assures a patient they are making a correct decision. This first act of the practice production plays a significant role in a patient's perception of the practice, but has no direct involvement from the medical provider. Your front office staff, call handlers, patient coordinators, medical assistants, and even your marketing shape the first impression of the practice production. For this reason, I encourage you to share this presentation with your office staff. As the individuals directly responsible for creating the first impression, they are most intimately involved with the processes we will discuss and will have ideas that may help refine and improve your production. While listening to this presentation, I encourage you to take notes about what thoughts and concepts that you would like to have your staff pay attention to in order to seed their thought process.